Hey, it's Dr. Galvin with another COVID update. Today's update is, I've had, as often occurs, videos will show up, they'll go viral, and people will then start sending them to me and asking me my opinion. And today we're going to talk about this video from a school board meeting in Indiana. This Dr. Dan Stock, who's a family medicine doctor who came up and said a bunch of stuff, and people are kind of sending me this video. And again, as usual, there's truth and fallacies, and let's go through some of what he claims. First of all, I think he kind of overrepresents his credentials a little bit. He's a family medicine doctor. He did a 3-year family medicine residency. It sounds like he's done some additional functional medicine training, but he's not trained in immunology or virology. He sort of implies that he has all this experience and training that he probably doesn't have, but that's neither here nor there. I want to go through some of the claims and let's talk about them. The first one was about masks, and his point is that the virus particles are too small are so small that they can penetrate the pores of masks. And he's absolutely, it's absolutely correct. It's absolutely incorrect what he's saying, because we don't expel virus particles. We expel water droplets that are filled with millions of virus particles. And those water droplets are big enough to be filtered by masks. Now, the amount of virus in those particles really relates to how well they work. And I'm going to link to a number of papers that prove this point, including a retrospective study, a paper that looked at 14 or so different mass-based studies, all showing benefit. And the fact is, the more virus you have in the particles that are aerosolized, the more likely it's going to be contagious. So the Delta variant, very, very contagious. Surgical masks, probably not so good. I've been recommending N95 masks for people, or KN95 masks for people, going way back to when we had not the Alpha variant, the British one. But what he's saying is that we don't expel individual virus particles. They are too small. What we expel are these droplets of water vapor. And you can Google a sneeze. There's a video of a guy sneezing. You can see that he's not sneezing out virus particles. He's sneezing out a ton of water droplets. They are very filterable by masks. We've been wearing masks in the emergency department since this began, with almost no cases at all among staff. And that's all we've got. We got masks, gloves, a little bit of, we can't social distance. We can't do any of the other stuff. And masks have protected all of us very, very well. Secondly, he implies that the vaccination protocol is there to make the virus go away. That's never been the goal at all. You can't make a virus go away by vaccinating it. We've said from the beginning that this is not a sterilizing vaccine. This vaccine prevents you from getting sick. And the problem with the SARS-CoV-2 virus is that in certain numbers of people, it makes you sick. And some of them are very sick. A certain number die, and many, 30%, have long-term symptoms. So we're trying to prevent that. We're not trying to kill the virus. You don't kill a virus with a vaccine. It can't be done. So again, he's right, but he's wrong. That's not the vaccines are very, very good at preventing you from getting really, really sick and having to go in the hospital and dying. And especially compared to someone who's unvaccinated. Let's see. He implies that we don't vaccinate against the common cold, which he's right. Against RSV, well, we don't, because we don't have an effective vaccine, but there are candidates being worked on. And then he implies we don't vaccinate against influenza, the flu. I'm required by my hospital. I have a mandatory flu vaccine every year. So I'm pretty sure we vaccinate against the flu. Then he talked about this outbreak in Provincetown, Massachusetts. The county that he's talking about is this Provincetown, Massachusetts, and they had this. They had a bunch of vaccinated people that came out for 4th of July weekend, and they had these massive parties. And there's a great story about the detective work that went behind figuring this out. I think it was on NPR. I'll see if I can find a link. Otherwise, it's a great story. But basically, the people that were there said that the bars were so packed, people were shoulder to shoulder. So they crushed all these people together. And what happens when people went home and they started getting sniffles and headaches and some body aches, and they started testing, and a lot of them had COVID. And turns out they had close to 800 cases of COVID. 74% of them were immunized. Well, he then goes on to say that this is an example of antibody-dependent enhancement. Well, it's absolutely not. Look up what antibody-dependent enhancement is. It's implying that if you get vaccinated and you get exposed, you get a much worse case than you would normally. That's what antibody-dependent enhancement is. That's not what we saw at all. 800 cases, 4 hospitalizations, 1.2% hospitalized, 0 deaths. The vast majority of people that had it had cold symptoms, headache, body aches, flu-like symptoms for a couple days. So they had extremely mild symptoms. Vaccine did what it's supposed to do. We got a Delta variant that in our nasal passages. Now remember, the vaccine provides immunity in our bloodstream. It prevents the virus from moving from our mucous membranes into our bloodstream. If it's in your mucous membranes, you're going to get cold symptoms. If it's in your bloodstream, you're going to get blood clots and COVID pneumonia and everything else. So if you can prevent that, then you prevent illness. And that's essentially what the vaccine does. And that's what we're seeing. And that's what we saw in this group. Hardly any of them got seriously ill. 1.2% ended up in the hospital. Nobody died. What do we expect? About 10 to 15% of unvaccinated people are going to end up in the hospital. Out of 800 people, we should have seen 80 to 120 or so, and 2% deaths. So we didn't see any of that markedly reduced. And then he said something, there's no reason to treat the vaccinated any different than the unvaccinated. And he's absolutely right. Because now we got this Delta variant that has these really high viral loads in the nose. That's why we kind of all should probably wear masks again in crowded places, because the vaccinated and the unvaccinated can give out the virus, pretty easily with Delta. The vaccinated aren't going to get sick. I mean, they might get cold symptoms. They're not going to end up in the hospital or die. What are we seeing in the emergency department? I mean, we're seeing tons of unvaccinated people. A friend of mine, 39 years old, just admitted yesterday after failing the entire everything, ivermectin and flumaxazine and vitamin D and everything else. So it's not being unvaccinated and being vaccinated in terms of masks. We should probably treat people exactly the same. He's right about that. The risks are just greatly different. He gave this mumps example, and again, I think it proves the point, right? They think that half the people that had that mumps outbreak were exposed to asymptomatic carriers, but none of those people got disease. So who cares? If you're immunized, you don't care, right? If you're not going to get sick, that's the goal. The goal is to prevent people from getting sick. And then he talks about his own experience. Well, he took care of 15 patients. Really? In a year and a half, you take care of 15 COVID patients? I'm taking care of hundreds. And we've treated many patients with ivermectin and vitamin D and zinc. And many of them have done well, but I've had 2 admitted to the hospital despite that. And I've had numerous very severe cases that ivermectin really didn't seem to do anything. So those things are not cures. There's science out there that suggests it may be helpful. I do use them with my patients. However, it's not 100%. And I've seen plenty of admitted patients who have been on those medicines and have not done well. So do I disagree with the supplement recommendations? I just did a video. I've been putting out a supplement recommendation sheet since the beginning. We just updated it last week. I did a video about it. And what's been on it since April of 2020 when I put it out? Zinc, vitamin D, quercetin, melatonin, vitamin C, all those things I believe in. I tell my patients to take them. They will protect you, they'll enhance your immune system. They're not protection against COVID. They're not going to prevent you from getting sick, whereas the vaccine will. So that's my take on the video that everybody's been sending me. I'm Dr. Jeffrey Galvin. I'm a board certified emergency medicine physician, been on the front lines of COVID in the ER and in my own clinic since it began. Please look at us on Facebook and YouTube if you like what you see. If you want that supplement guide, I'll put a link upstairs. Just shoot an email to info@vitalitymwi.com or go to our website and put a submission in and we'll send it to you, okay? Have a great day. Stay safe.